Okay. Again, my name is Mike Tellerino. I'm with K9 for Veterans. We are located at 5430 West Roosevelt Road in Chicago. You could reach us at the 773-854-1000. I'm here tonight. We have a special guest, Corinne Belsky. She's a doctor. Corinne, would you tell us a little bit about yourself?
Sure. I'm a psychiatrist. I work at the Captain James A. Lovell Federal Health Care Center in North Chicago. And I'm not here to represent them, just really to educate about PTSD today. Because I work in a veteran setting, I see a lot of post-traumatic stress disorder. The facility I work at also sees active duty military, which is unusual for a VA, so I see a lot of PTSD at different stages. And as well as the main facility, I work at the clinic in Evanston, Illinois.
Okay. Can you tell us what, for the audience that doesn't know, what is PTSD? What exactly, how would you define
So
that?
PTSD is really a cluster of symptoms that we may see in people who are exposed to trauma. Mm-hmm. We hear about it a lot more recently, but it doesn't mean it's a new condition. The symptoms are a result of trauma in a person's life. And trauma's been around since the beginning of time, and so has PTSD. It's been called different things at different times. There's a lot more recognition and acknowledgement of it in more recent years.
That's where we got the PTSD name.
Right.
Before it was shell shock, all different names.
Yeah, battle fatigue. During the
fatigue,
Civil War, it was called the Costa syndrome after the physician who recognized some of the symptoms. And most people who are exposed to a trauma do not develop PTSD. That's the good news. But what it consists of is exposure to a trauma, and that has to be actual or threatened, either death, serious injury, or sexual assault. And the person has to have either experienced it, witnessed it happening to someone else, learned of it happening to a very close family member or friend, or it can happen outside of those criteria if it's very recurrent. So say you're in an occupation, maybe a police detective who's constantly going on scenes, very violent scenes. There's a cumulative effect to that at times.
So it takes on many forms then?
Yes. And it's broken down into different clusters of symptoms. It also has to last, the symptoms have to last at least a month before it's diagnosed. So you can't diagnose PTSD a day or a week after the trauma happened. It also has to cause major social or occupational functioning problems in the person's life. Maybe they can't hold their job down anymore, their marriage is falling apart, they don't want to socialize anymore. And the symptoms are broken down into these 4 clusters. And the 4 clusters are intrusive symptoms, avoidance symptoms, a change in the way, like a negative change in the way a person thinks or feels, and hyperarousal symptoms. And I can briefly give an idea of what some of those symptoms would be.
Please, that would be interesting.
And a patient does have to have symptoms from each one of these 4 categories. In the first 2 categories, they need 1 symptom each. In the latter 2, they need 2 symptoms each. So we'll start with the intrusive symptoms. And these would consist of intrusive unwanted memories of the event, nightmares, flashbacks. Flashbacks are really dissociative experiences. They're not very common, but they're impressive when they happen. Other intrusive symptoms could be reactivity to psychological reminders or reactivity in a psychological way to triggers or reactivity in a physical way to triggers. And then the second category of symptoms, which are the avoidance symptoms, that would be either avoiding internal reminders like thoughts and feelings or avoiding external reminders like situations, people. And then we get to the third cluster of symptoms. Those are the negative changes in mood or cognition, meaning thought processes.
Cognitive, right.
Right. And these could consist of things like amnesia for the event, Other symptoms could be loss of interest, a persistent negative emotional state, like feeling guilty all the time, feeling ashamed all the time, feeling angry all the time.
Right.
Other symptoms could be detachment, blaming oneself, or not being able to experience positive emotions anymore. And then we get to the last cluster of symptoms, which are the hyperarousal symptoms. And these consist of things like hypervigilance, increased startle response. For instance, if a car backfires or a firework goes off, the person might
Right.
be very jumpy to it. Irritability, recklessness, poor concentration, and poor sleep.
Why, explain to us why some people can go through a horrific experience and wind up with PTSD, and some people just seem to deal with it.
We'll never totally have an answer to that, but some of the things that we do know make a difference are whether they had emotional support at the time. It's very important for people to be able to talk and vent about what they went through early on. In fact, it's one of the reasons why military units nowadays try to keep people together as a unit and not separate them and move them from unit to unit anymore, because that cohesion is so important
That
for
bonding.
dealing. Yeah.
Right.
Another important issue would be whether they had past traumas or not. You would think if somebody had previous traumas, they'd almost build up a thick skin and be able to deal
Sure.
better with traumas in the future, but it tends to be just the opposite. Say somebody,
You're saying the more trauma they have, then it could be...
potentially it could make the next trauma worse.
Right.
And the reason for that is probably because I'll just take a different kind of PTSD than military. Say somebody's abused as a child. They think they dealt with it, they've moved on, they're not really experiencing symptoms. And then as an adult, maybe they experience military sexual trauma. Well, now they're not only dealing with the recent adult trauma, it brings back all the memories of the childhood trauma. So they're really dealing with two traumas at once now.
How...
And let me just tell the last factor that's really important in recovering from a trauma, and that's resiliency. Resiliency is one of the accepted views of what resiliency, first of all, resiliency is being able to recover from something and bounce back. So one of the views, and actually this is from a recent book on the market called Plan B by Sheryl Sandberg and Adam Grant, they consider the most important factors in resiliency to be, number one, not blaming yourself. That's the biggest detriment to recovery.
Sure.
The other two issues that they point out are not thinking that because this one aspect of your life is bad, that every single aspect of
Right.
your life is bad. You need to recognize that you're struggling from the trauma, but maybe you have one or two good things in your life. Maybe you have a supportive spouse, or maybe you have a decent job.
Right.
And then the third factor is, even though things are awful right now, at the apex of the trauma, they won't remain at that level forever.
So there's light at the end of the tunnel, type of thing. When do the symptoms usually first appear? And when our veterans return home from service with PTSD, typically when do these symptoms appear? When do they typically surface?
It's very variable. So some people may experience a trauma and be symptomatic from the moment it happens.
Really?
At least then they know they can get treatment right away. I have many patients who don't know for decades that they have PTSD. They just stay so busy
Right.
in their work years or raising a family that they're basically able to suppress what happened. And what I see a lot is that when they hit age 65 and retire, it's a big problem. You get a second surge of PTSD at that age. All of a sudden, they're not going to work. They're sitting home all day, and they have time on their hands.
To think about things.
And they
right.
start thinking about things.
How does somebody go about, when our veterans come home, how does somebody go about getting diagnosed with PTSD? What are the symptoms that they look for to actually get that diagnosis of PTSD?
Well, first of all, it's really important not to diagnose yourself and not to have a friend or family member diagnose you. It should be done in a clinical setting by a psychologist or a social worker or a psychiatrist or a regular medical physician. Because there are other things that can confuse the picture. Sometimes it's a medical problem that's mimicking symptoms. Maybe the person is getting very anxious all the time because they have a thyroid problem. Or they're not sleeping because they have sleep apnea. Or maybe their symptoms look like PTSD, but it's really a substance abuse problem or another mental illness.
What's the treatment for PTSD?
I break it down into 3 different kinds of treatment. One would be medication by a physician or specifically a psychiatrist. The second category of treatment would be therapy. And the third would be alternative treatment. So let's go through those one by one.
Please.
In terms of medication, that's mainly what I would do as a psychiatrist. We don't have a medicine per se for PTSD. We treat people symptomatically. If a patient comes in and says that their biggest complaint is that they can't sleep, then we focus on sleep meds. If they're having nightmares all the time, we have a medication that's very helpful with nightmares. If they're having bad irritability problems, we can use a mood stabilizer. Some of the really good medications are what we call the SSRIs. They work in a chemical called serotonin in the brain that helps with depression and anxiety. And they're safe medicines for the most part. They're not addictive. And they don't have a lot of side effects. What we try to avoid are the benzodiazepines. Benzodiazepines are anxiety medicines that a lot of people think of as the magic cure because they work right away on the spot. The problem is they're addictive, and so people get used to them and they don't work anymore, and they need more, and they need more, and they need more. So again, it's very symptomatic what medication we decide to use for a person, but we usually start with one of those medicines for depression and anxiety that prevent the anxiety. Let me talk a little bit about the other 2 treatment mechanisms, unless you wanted to comment on the medications.
No, please.
Okay. As a psychiatrist who uses medications to treat people, I have a very high opinion of the psychiatric medications. They're very beneficial. And I think that for almost all psychiatric disorders. In PTSD, the results are not as good. It is very important. I think because they treat symptoms well, and certain disorders that psychiatrists treat, it really is a chemical imbalance. Bipolar disorder, schizophrenia, there are medications that work wonders because they adjust the chemical level. In PTSD, it's not so much about chemical levels and neurotransmitters, although they are affected, but you really need to get to the root of the problem, or the symptoms just don't go away.
Right.
So I do usually refer my patients to a therapist, either a social worker or a psychologist, so that they can get therapy as well. And really, for my PTSD patients, if they were only willing to pick one treatment modality, I would say go with therapy rather than medications.
How long does therapy last?
Therapy can last a very varied amount of time. It can be a month, it could be a lifetime in a really severe case. I'd say the average is maybe 6 months, but the therapeutic modality may change.
Right.
So they may start off in individual therapy. A lot of patients feel they're not ready to go into a group setting. They may have a lot of anxiety in a crowd. But once they've worked a little while, maybe a couple of months with an individual therapist, it is a good idea in PTSD to go into a group setting for therapy. To be in a group of other people who have experienced something similar, it's very helpful. In some regard, it normalizes the symptoms and can take away shame related to events that may have happened. So that's really helpful. Besides individual therapy and group therapy, which is usually done on an outpatient basis, for serious PTSD that doesn't seem to be getting better, sometimes it's a good idea to do a month-long or 6-week inpatient PTSD program where you live and eat and have therapy groups every day for that amount of time. It seems to be very beneficial for the patients. A lot of times they come kicking and screaming to it. They don't want to be away from their jobs or their families, or they don't have time. But I've never seen anybody regret doing an inpatient
How lasting
program.
is that?
The benefits of
Yes.
the inpatient or any therapy?
The inpatient, where they stay there.
It depends on the person. So I don't think I have a good answer for that.
Okay.
There are patients who do it multiple times throughout their life. They may get a lot of benefit, but then they realize 5 years later it might be helpful to do it again.
But it's better than the outpatient treatment.
I can't say that because it depends so much on the patient. I generally think of it as the next step after group treatment. Not everybody's
Right.
going to need an inpatient program because it is time consuming and
Right.
does take people away from parts of their life.
I'm sorry, go ahead.
Sorry,
No,
I keep
go
doing
ahead.
that to you.
No, go ahead.
I just want to go over the third treatment
Please.
modality, which are the alternative treatments. There are several. I'm sure I'm not even thinking of all of them. My personal favorite one happens to be therapy dogs. I love having dogs in the office, and that's a perk of having a patient with a therapy dog. But what I see in terms of benefits for the patient are several. The one I probably hear the most is that patients can now get out of the house. A lot of patients with PTSD want to avoid everything. And they just stay home and sometimes do nothing with their lives, and you just see their life wasting away. When they go out, they're so hyper-vigilant and on guard, it's just too unpleasant for them.
Right.
When they have a dog with them, they feel that they can let their guard down.
Exactly.
They feel that their dog is on the alert for them.
They have their battle buddy with them, basically. They're watching out for them. They got their back, and they could feel more at ease to go out in public and do the things typically that they did before their PTSD kicked in.
Right.
It's such a huge. I've seen it help in so many different ways. I mean, these service dogs provide such a service to our veterans. It's unbelievable. It truly is. There is a lot of clinical value to having a service dog.
Yeah, I see a lot of improvement when my patients get them. Another thing is a lot of the patients isolate. They maybe because of irritable behaviors or isolating from their spouse. They've kind of pushed everyone away, their family
Right.
and their friends, and they really have no one. When they get a dog, they've got a constant friend with them, and it
Exactly.
helps their self-esteem.
Exactly.
Yeah,
It's huge.
I've seen very good results from that. Some other alternative modalities, exercise. I tell patients with every kind of mental illness, exercise is so important.
Is it really? It has
And-
that much of a role?
Yes, and the reason is when you exercise, it releases chemicals in the brain called endorphins. Endorphins are related to opiates, just like opiates you would use for pain or that patients abuse because they feel good, but these are safe ones in our body and at safe levels. And so when you exercise, and it does need to be cardiovascular, you've got to get your heart rate up, you can't just take a relaxed
Right.
walk. It will make you feel better for hours afterwards. Your anxiety levels and your depression levels will go way down. Some other treatment modalities. I have some patients with PTSD who swear by acupuncture. I've had one or two say that a technique called EMDR, which is eye movement desensitization and reprocessing, that's helped a few of my patients, although there's somewhat mixed results on that.
Right.
But my feeling is whatever works is fine,
Yeah.
as
whatever.
long as it's safe and it works.
Where can veterans go for treatment? I mean, are there a lot of options out there? I know the VA has, a hospital that they treat our veterans for PTSD. What are some of the options out there for the veterans with PTSD?
There are a lot of options. I do think the veterans hospitals are a good place to go because there are so many services available. Psychiatrists, social workers, different programs, inpatient programs, outpatient programs, substance abuse programs. Also vet centers. Vet centers don't provide medication, but they provide very good therapy. At least the ones that I'm familiar with.
Right.
People can also go to their local physician or a private psychiatrist,
Right.
or a veteran. They can look up a veterans group online.
Last question I have for you. What should family member or friends do if they suspect that their loved one has PTSD?
They should urge them to get treatment, and hopefully the patient is willing to get it. But we do see with all psychiatric conditions, sometimes patients are very wary of getting treatment. They think they're going to be labeled. They think it's going to follow them around. So if they're not willing to get treatment, one thing that can be done is doing an intervention by family or friends where everybody gets together and confronts the patient, or they all do it individually. It
Right.
doesn't have to be everybody at once overwhelming them. And when the patient hears it from multiple sources, they're more likely to listen.
Right.
There's also, and I just learned of this recently, there is a national phone number called Coaching into Care through the VA that can guide family members and friends as to how to get the patient help. And that phone number for Coaching into Care is 888-823-7458.
It's an important number.
So again, that's 888-823-7458.
You really gave us some useful information, and I want to thank you for coming out and
Thank you for having
explaining. Oh, it's our pleasure. You know, we just want to get it out to where we know what the warning signs are when our veterans do come home with PTSD. What should the family look for? And what are the symptoms that they're displaying that, you know, how do we get them the help that they need? And I think that's the key in what we're doing here tonight. So again, I just want to thank you for coming out today. Again, this is Dr. Corinne Belsky. She was gracious enough to come on tonight with us, and hopefully you'll be back again.
Thank you for having me.
And again, my name is Mike Tellerino. I am the CEO of K9 for Veterans. K9 for Veterans can be located at 5430 West Roosevelt Road in Chicago. Our phone number is 773-854-1000. You'll see our website there, which is K9sforveteransnfb.org. If you're interested in coming out to our training center to help us work with our service dogs and train them for our veterans, please feel free to give us a call, stop out there. We could use your help. Our veterans are out there training with their service dogs. We train 6 days a week. So give us a call if you have some free hours to donate to help our veterans train these service dogs. Don't hesitate. Give us a call. We could really use your help. And again, I'd like to thank you for tuning in this evening, and again, thank Dr. Corinne Belsky for her time. Thank you.
Thanks.